Let's face it, checking your blood pressure at home feels easy. You just strap on the cuff, hit the button, and read the numbers. But what if I told you that small, everyday mistakes while measuring your blood pressure could lead to completely wrong results? Sometimes off by 10, 20, or even 30 points. These wrong numbers can create panic when there's no problem at all. Or worse, they can hide a serious issue that needs urgent attention. So in this video, we're breaking down 9 common mistakes people make while checking blood pressure and how you can fix them, starting today. Blood pressure is like a silent signal from your body. If you get it wrong, it may lead to unnecessary medication, wrong treatment, or a missed warning for heart disease or stroke. So let's help you get it right. Mistake number 1, placing the cuff over clothing. Many people wrap the blood pressure cuff over their shirt or sleeve just to save time, but this creates a false reading. Clothes, even thin ones, interfere with the pressure the cuff applies to your artery. This extra layer makes it harder for the machine to detect the true pressure, often causing readings to be 10 to 20 points higher. To avoid this, always place the cuff directly on bare skin, preferably the upper arm. Mistake number 2, not resting before the reading. Did you just walk in, climb stairs, or talk on the phone? Even small physical or mental activity before checking your blood pressure can affect the numbers. Your heart rate and pressure increase with movement or stress. If you don't allow your body to calm down first, the reading won't show your true resting blood pressure. Sit quietly for at least 5 minutes with both feet on the ground and don't talk during this time. This helps your body return to a natural resting state. Mistake number 3, arm not at heart level. Your arm must be at the same level as your heart. If it's hanging low or raised too high, gravity changes the pressure inside your blood vessels. A low-hanging arm can give a higher reading, while an arm that's too high might show a lower reading. To get it right, rest your arm on a table or pillow so it stays relaxed, flat, and even with your chest. Mistake number 4, talking or moving during the test. Talking, laughing, or even moving your fingers while the cuff is inflating can trigger muscle activity and alter the results. Your body responds to every motion, even subtle ones, by slightly increasing blood flow and tension. That small increase can falsely raise your systolic or diastolic numbers. During the reading, stay silent, breathe normally, and sit still for the most accurate result. Mistake number 5, crossing your legs. This one surprises many people. Sitting with your legs crossed at the knees or ankles during the test can squeeze your blood vessels, slightly raising pressure in your lower body. That pressure travels upward and affects your blood pressure reading, especially your systolic pressure, which may increase by 2 to 8 mmHg. The correct posture is simple. Sit with your feet flat on the floor, back straight, and don't fidget. Mistake number 6, using the wrong cuff size. A cuff that's too small will squeeze too tightly, leading to falsely high readings. A cuff that's too large will not apply enough pressure, giving lower than actual readings. This mistake is especially common for people with larger or smaller than average arms. Use a validated blood pressure monitor with the right cuff size for your arm circumference. You can find this info in your device's manual or ask your pharmacist or doctor to help you measure and choose the correct size. Mistake number 7, full bladder. Here's something most people never think about. A full bladder doesn't just make you uncomfortable, it also causes physical stress on your body. This activates the sympathetic nervous system, which can raise your systolic blood pressure by 10 to 15 points. Always use the restroom before you check your blood pressure. It's a simple habit that makes a big difference. Mistake number 8, taking only one reading. Your blood pressure naturally rises and falls throughout the day, depending on stress, time, posture, even temperature. If you take just one reading, you might catch a temporary spike or dip, that doesn't reflect your real condition. Instead, always take 2 to 3 readings, spaced 1 minute apart, and then average them. This gives a more balanced and reliable number that doctors can trust. Mistake number 9: using a wrist monitor incorrectly. Wrist monitors are popular for their convenience, but they're also more sensitive to movement and positioning errors. The arteries in your wrist are smaller and closer to the surface, which makes readings less stable. If you do use a wrist monitor, make sure your wrist is kept at heart level and supported, with no movement. But for best results, experts still recommend upper arm monitors that have been clinically tested and approved. So now that you've seen the 9 most common mistakes, take a moment and think. How many of these have you been doing? Most people are shocked to realize they've been checking their blood pressure wrong for years. The good news is, it's not hard to fix. Just a few small changes in your routine can lead to accurate readings that truly reflect your health. And remember, blood pressure is not just a number. It's a signal from your body about how hard your heart is working. Getting that signal right could mean catching a disease early or preventing a serious event altogether. If you found this video helpful, please consider subscribing to our channel. We simplify health topics like this every week, helping you make smarter choices for a longer, healthier life. Also, share this video with a family member who checks their blood pressure regularly. They'll thank you for it. Thanks for watching and stay healthy. I'll see you in the next one.